Nurse
no
Kev.
better way to return into the industry than to be here in the one and only, the best aesthetic podcast with Nurse Lizzy.
I love it. I love it.
Yeah, I should do like hosting, right?
So Kev and I will be hosting your next party, your next bat mitzvah. We've been waiting. I was like, where is Nurse Kev? Nurse Kev has appeared.
Right here, like no other place, like no better like way to reintroduce myself. Doing like a podcast. So
Yeah.
yeah, so all the questions you guys have been dying to know will be answered here. And yeah.
So excited. So Kev is just gonna lead the way at this point, right? He knows what's going on. What have you been up to? Where did you disappear?
So I mean, oh my God, it's a lot. But honestly, like right now, I'm just relaunching myself under my own brand. I feel that this is something, well, actually, it's something that I've actually done before. I don't know, like, this is something that a lot of people don't really know, but I actually started doing injectables on my own. And then that was back in 2021. I was down at King Street, rented out my own space, but I didn't really have like the necessary skills and confidence, and like doing kind of like managing a business on your own. It's tough, right? Especially as injectors, we should be focusing on like skill more than just like answering DMs, like accounting, doing all of that. So yeah, I think doing this now at this stage where I'm at, I feel like it's much better than it was before. So I'm excited, and yeah,
I'm excited for you.
thank you.
And I'm welcoming you back to
So
this
excited to be
industry.
back.
Yeah.
Oh my gosh. It's like I just felt like I didn't even feel like I actually like left. And honestly, it's actually been like a year and a half. Can you believe it?
It feels like a
A
year.
year and a
Like,
half.
yeah,
But
that's insane.
like and to me it didn't really feel like that long. Like, like I actually started, like last week. I had a few clients come in. I mean, like I was nervous, not nervous in a sense that like, oh, did I lose all my skill? But nervous in a sense that like, oh my God, like this is all you, right? It's just, like how are you going to, let's say, like do on your own, right? Because to me, where I left off on my own, right, back in 2021, was kind of like very, like, yeah. But
Yeah.
now I was kind of like, okay, let's just see like how you are with all like the stuff you have on. So
What have you been doing this past year and a half?
literally just like, trying to build the foundation for my own brand. Just like making sure like I got like all areas covered because I'm basically just like doing all on my own, right? Making sure like I, like have the legal aspects, when it comes to injecting covered, like having your own space, um, and just making sure that once I'm out there again, then I don't go anywhere else again, right? Because it is a tough
Yeah.
industry to survive in, right? So, but if you once you know like what you're doing, um, you'll be all right.
Yeah.
Yeah.
And tough industry, like there's a lot of competition, or is it the people in the industry?
Uh, I'm not. I don't think it's competition really. I think like everybody has like something unique to offer, right? I remember like with like the words of my very first medical director, right? There's room for everyone, right? Everybody has something unique to offer. Even though like all of us, like we're all offering the same treatments, we're using all like the same products, right? But like all of us individually will have that special something that will kind of like draw like our own people, right?
Mm-hmm.
There's like always somebody out there for everybody, right? So that's why no matter, let's say, like how many of us emerge, right, like we will still get ours, right? We will
Yeah.
still find our own people, right? Because for me, like I got the luxury to work, like in a very under like a very successful brand, right? And like um knowing like the roster that like I was with, like I work with some of like the most talented instructors because I got to really like see how they work, like like alongside them. But to still kind of like like be booked out, still have like people come and like look for you, right? Even though if you had like also like really good people around you, like I kind of um proven that like that theory is real, right?
Yeah.
So
All
yeah.
right. And what do you want to share to your patients from back then and today?
Today, oh my gosh, you guys, I built this all for you guys. Like honestly, like in my mind, I was like, you know what? I would probably just like, it's easier to just kind of like, I just kind of like throw in the towel, right? It's kind of like, what, like I left, like it's less stress on me, and if I were to ever go, that's gonna be like more things to think about. But, like in the end, I'm kind of like, what, like I can't just like leave like the people who kind of like trusted me, like who kind of like built, who became comfortable, like with me. So that's how I always felt like I have to do something for them. I have to come back. At least I have to try, right? If it goes well, it goes well. If it doesn't, at least you tried,
Yeah,
right? And, like luckily, like now, like seeing kind of like the feedback, it's like I, like the month hasn't even been done yet, and I'm already like sold out of inventory. I have to order more. I was like,
I
oh
love
my
that.
gosh, it's
Yes,
insane. So that's why I was like, what? If you don't try, you will never know, right?
exactly.
So that's why you always just kind of like, what? I'm gonna work hard and just kind of like see like where that's going to take me,
Okay.
right? Yeah.
Before we move on, what do you use on your lashes?
I use a either a Shu Uemura
Oh,
lash curler or a Tweezerman from Shoppers, depending on your budget. So those two, right? I don't really use anything for like my lashes. They always grew out long like that.
beautiful.
Yeah, thank you. I didn't like them at first because I thought they were a little too kind of like girly, but then I was kind of like, you know what? It brings out my eyes a little bit more and it makes me look a little bit more like interested.
Yeah, and
I mean, my
wait.
lashes curl down, like, they just go like this and it's kind of like, but now in here I'm like,
It's perfect. How did you get into nursing and aesthetics?
oh my God, nursing, it's very, very easy. See, the accent is already coming out, you guys. Like the Filipino accent is coming out. Like, I'm Filipino, nursing, like that's it. If you flip through the dictionary and look at a nurse, you'll see an image of a Filipino person there because literally, like, it's just that,
Yeah,
But no, in reality, it was my mom. My mom, she was kind of like, because I generally didn't really want to do anything.
yeah,
I didn't, well, it's not I didn't want to do anything. I don't know what to do.
yeah,
It's like, I don't dream of working.
yeah.
Like we,
No.
right? Come on, let's be real here. Like I don't have a dream job. I don't dream for a job. But
Yeah,
the thing is that what she told me, I was like, you know what? At least do something, right?
yeah,
And do something useful, right?
yeah,
In like to be honest, like nursing is such a great profession because there's a lot of possibilities there.
yeah.
There's a lot of areas you can branch out to. If you find one that you don't like, there's another department that you might like, right? So that's why I felt like, you know what? Let me go for it. Let me see what it's like. If I can survive it, turns out I'm actually pretty good at it. I don't mind all that bedside stuff. Like that's where I actually got to learn like a lot of like, good communication skills, really good bedside manner, critical thinking, right? So that's why when I have clients who are also nurses who also kind of like want to get into this industry, like I always tell them like never like never discredit going into bedside. Like I
Hmm.
always tell them, if you can, at least do 1 year of bedside, right? And then do aesthetics because, like you can tell the difference, like of what a nurse, an injector who was a bedside nurse versus who wasn't.
Interesting.
Yeah, like
Okay.
I feel like I probably would not have been able to have, let's say, like the communication, like the bedside manner, and also kind of like the critical thinking, right?
Uh-huh.
and the confidence to kind of like actually do the treatments if I wasn't in a traditional healthcare setting.
Hmm.
Because in that area, like stuff happens like crazy, crazy stuff happens,
Yeah.
right? And then once you kind of like get exposed to that, right? And then you go into this, it's kind of like the soft girl nursing, right? Like you are like, you'll be good, you'll be all
Yeah.
right, right? And then the clients, they actually got to they'll appreciate, like how kind of like warm, how caring you are. They'll actually feel your energy, right?
Hmm.
And then for me, like all that, I got through bedside nursing. Yeah.
And which unit were you on?
Complex care, people, they don't talk, they don't move, they know nothing, post strokes, they're just kind of like, like tubes everywhere, right? And that's where you kind of like, that's where I developed like, your compassion, right? Like literally kind of like caring for people who can't even like do anything for themselves, can't even talk. So it's like literally like your assessment skills will be like so good because how how can you tell a person is feeling some sort of way without them being able to tell you verbally and non-verbally?
Yeah,
Yeah.
that's big. How long were you in bedside?
Like over that unit, like over 3 years.
Wow.
And then I moved into acute care for a little bit, just for more kind of like hours wise, because um, complex care is like more 8 hour type of job. So it's like you're almost there like every day of the week. And then if you go
Hmm.
a little bit more kind of like acute, that's where you work like the traditional 12 hours, right? You get more days off. But that 12 hours, like if you have like a really, really bad assignment, oh my God, it's crazy. You will
Yikes.
feel it like in that 12 hours, you just want to die. But yeah.
Okay. So every nurse you feel they should go into bedside or
Yes,
before doing
yeah,
aesthetics.
there is so much to learn
Yeah.
into it. Like there's so much transferable skills. Like I highly, highly recommend it. Like it's not gonna let's say like make you like a really good injector, right?
Hmm.
But like as like let's say like and like basically just like as like a nurse, right?
Yeah.
Right? Because before injectors, we are nurses,
Yes.
right?
Yes, we always
Yeah,
have to remember that.
yeah, we are nurses first before we are injectors.
Yeah. And with that comes we have to be honest,
Mm-hmm.
empathetic,
Oh yeah, absolutely.
and like you said, the critical thinking
Mm-hmm.
and quick on our feet.
Oh,
So
absolutely,
if God
absolutely.
forbid a bad event happens,
Oh yes, yeah.
an adverse reaction,
That too,
sorry,
right?
that's
The
the right
adverse
word.
reaction, you get a
Yeah.
complication, right? You won't be losing your like shiz, like running around like a confused chicken, like, oh my God, my patient passed out, right? I have a lot of clients who pass, like not a lot of clients. I have like a few clients who are kind of like my regular pass outers,
Hmm.
right? And like because like knowing what kind of like like happens, like that whole process when somebody pass out and all that, I don't get freaked out, I give
Yeah.
them a couple minutes, they wake back up, okay, we'll start back again, right?
Yeah.
But if I, let's say, like didn't really know like what like syncope is, right? People would just be like dialing like 911, oh my God, somebody's passed out here, and I'm just kind of like,
It's
it's
okay.
all right, you'll be all right,
Yeah, been there,
yeah,
done that.
been there, done that, right? It's like because in the back of your head, I know what to do, I
Yeah.
know what to look for, right? And I know like how I will be able to make sure that this person is okay, right? And that happens too in aesthetics, right?
Yeah. And then you do lip filler, right?
Mm-hmm.
What else do you
Love,
do?
love, love, love lips. Like
Yeah.
honestly, like I mean, like I think like my main weapons of choice
Yeah.
is filler and Botox. That's it,
Yes.
right? Like I mean, anywhere on the face that you can inject, like you name it,
Yeah.
right? Some I probably kind of like, I don't know, like some are probably just like, like I would do on myself,
Hmm.
because probably it's a little bit too like risky or scary to do on other people. But, like everywhere, like, like your usual chin, cheeks, jawline, like temples. I mean, I even do like noses. I did brow filler. I don't know if like people kind of like, yeah, yeah, over here, you know what I'm
Nice.
saying? Sometimes if you want a little bit of deep set stuff in there, you can do it.
Yeah.
Yeah,
Smart.
yeah. I mean, risky, but you can.
Yeah, if you do it well.
Yeah.
For when I do temples, actually,
Yeah.
I do go into the brow
Right.
for a
Yeah.
good lift.
Mm-hmm. Right. You get a little bit
And
of
that is in the
tail in
bone
there.
where
Yes.
you're talking about, right?
Yeah. Yeah. I mean,
I mean, you do the actual. You go in with a cannula,
I
right?
mean, I'm more cannula
Yeah,
over around like
gunshot.
there because sometimes even though when I do like all the way down the bone, when I aspirate, I still get a little bit of flashback. So that's why
Mm.
I think like anywhere that I feel like the higher the risk, the more likely I will use a cannula.
Yeah.
I mean, not that saying that cannula is totally like risk free, but
Mm.
it's just kind of like more added safety
It's
in
good.
that aspect. Yeah.
It's good. What about piriform fossa?
Piriform fossa. I mean, it depends on like the
Depends.
person, cause for me, like I hate piriform fossa myself. I'm sorry,
It
like,
hurts.
huh?
It hurts,
It
right?
does. It does. It feels like I always tell my clients like it feels like you're getting like you'll feel it in your gums.
Yeah.
It's
Yeah.
so gruesome. I tell them like feel it in your gums. You feel like something is kind of like ripping through there, right? But I think once you kind of give them like an idea like of what to like expect, they generally do great. Yeah, they generally do well.
Yeah.
Yeah.
Yeah. That one does not sound fun.
Yeah. No, it doesn't. Yeah.
Yeah. Different kind of injections.
Mhm. Mhm.
And when someone is looking for an injector, what are green flags and red flags for this patient to look for?
You know what? Well, start with the red flags. I know like everybody will probably say that like, oh, someone who looks like too overfilled, they look washed, they look this, blah blah, this and that. For me, I feel that like somebody who has like let's say overfilled like a botch face doesn't necessarily mean that they're a bad injector, right? Maybe that's just kind of like how they want to express themselves, right? To us they look
Mm,
botched, but to them maybe this is their dream face. Who knows, right? Who are
yeah.
we to judge, right? But for me, what I really kind of feel like it is an actual red flag are the ones who haven't got anything done in their face,
Okay.
right? If you're
Yeah.
an injector and you're telling me like, oh, I've never got anything done on my face,
Mm-hmm.
I don't know why. Maybe if you think that's kind of like, oh, like I'm one of the 1%, you know what I'm saying? Because to me, it's like, how can you sell me something where you can't even vouch for yourself,
Yeah.
right? The treatments that I do, the treatments that I offer, I've done all of them,
Mm-hmm.
right? I have, if I offer Botox, because I've done Botox, if I've done, if I offer chin filler, jaw, cheeks, nose, lips, every kind of brow filler thing, it's because I've done it,
And you
right?
liked it.
I
Yeah.
liked it, right? Sometimes, like I did it, but I kind of didn't really kind of feel like it suited my face. I just
Mm-hmm.
like did it because I feel like, oh, I feel like getting poked today. Let me just
Yeah.
do it. But, like I can like I can vouch for the treatment, right? I can give you like a vivid explanation of what to expect,
Mm-hmm.
of tell you what's normal, what's not normal, because I have first-hand experience with that,
Yeah.
right? So like with somebody who hasn't had any of that, like how can you like reassure me that what I am feeling is normal, right?
Exactly.
So that's why I feel like is kind of a red flag in an
Okay.
injector,
Mm-hmm.
right? So green flags, definitely somebody who knows how to communicate,
Yeah.
right? Somebody who also knows how to listen, someone who also includes you in the decision making,
Mm-hmm.
right? Because, like, yeah, we are the injector. Like, we see our clients in another perspective, different from theirs, right? But at the end of the day, like, one's own opinion is the most important than everyone else's,
Yeah.
right? So if you are able to kind of like meet somebody in the middle, right? I think that's such a good red flag, right?
Yeah.
Because you can't always just be saying like, oh, like I think, right? So maybe it's like something that, okay, we'll try it. If not, then we'll reapproach it in a different way,
Yeah.
right? So I think that's, like a green flag in like in a good injector.
Yeah, I agree.
Yeah.
That's a good one. We have to work together. We
Hmm.
can't just like say you need chin filler, but the patient likes the chin like that.
Yeah, yeah, right?
It's like a butt chin. Some
Yeah,
people like butt chins, some people
yeah,
don't.
yeah. Right, and especially and imagine kind of like recommending like I think you need like this, but like that is kind of like
What they love about
what they love,
themselves.
the only thing that they love about
Yeah,
themselves, right?
is the
Like, and
butt
then you
chin.
just kind of like tell
Yeah,
them like that's the one. I'm like, oh my God,
I know.
yeah,
I know. We've all been
good,
there. We've all done it. I don't know if you
yeah.
have. I have for sure.
Oh, you know what? I always tell my clients, like, I'm like Burger King. You can have it your way here. You know what I'm
Yeah.
saying? But don't go crazy.
Yeah. Yeah. Don't go crazy. We're stopping you at the
That's
crazy.
like me and my clients. Oh,
How can patients protect themselves?
patients absolutely need to protect themselves. Patients, because we're patients too,
Yeah.
right? Like, I believe patients, right? Before you even go and book your appointment, you have to know, right? Like, what these things are,
Yeah.
what is getting injected in you, right? What are
Mm-hmm.
the side effects? What are the risks? I know it is your injector's responsibility to, uh, like disclose that to you, but also like as a consumer, you also have to know,
Yeah.
right? Because sometimes there's information, right? If you go to a kind of shady injector, they can leave those, like information out, right? So you also have to kind of like be vigilant, right? Because like it's also your responsibility to protect yourselves, right? You have to know, like like the law, right? Of like what's legal, what's not, like in terms of kind of like products, in terms of like providers, right? Because there's a lot of things out there like right now, that's kind of like, like people going rogue, right? And you don't even know if they're qualified to do these kinds of things,
Mm-hmm.
right? So that's why I feel that, like people, like just, just do your homework before you do all of these things.
Yeah. Yeah. Do
Yeah,
your
you're
research.
right.
Even though a lot of the times on TikTok and Instagram, there is some false information.
Oh yeah, absolutely. It's so much.
Yeah. But definitely,
Mm.
I find that a lot of the times patients don't know that there is a risk of vascular occlusions
Oh yeah, yeah.
or what it is. How do you bring it up when they say that there is a risk of a VO?
Oh my goodness. It's
Like,
just, well, I mean, it's one of those things, right, that you really have to kind of include because, like if it happens and they don't know, like,
yeah.
right? So, but you just have to be transparent. You just
Mm-hmm.
have to be honest,
Yeah.
right? People will appreciate it more,
Mm-hmm.
right? That you disclose this information that can help them actually, like make a better decision, an informed decision,
Yes.
right? To kind of like leave that out to, like make them, make a decision based on what you want them to make, right? Just by leaving information out, that's not really ethical,
Mm-hmm. It's
right?
not.
It's not really ethical, right? So that's why it's like it comes down to your integrity as an injector, right? If you can, like you want to be able to sleep at night,
Mm-hmm.
right? So that's why I feel like when you disclose this information, be as honest as you can, right? And just, for you to yourself, just know like how you'll be able to manage it,
Mm-hmm.
right? And then let them know as well, right? Because
Beautiful.
you can't always just be throwing that this is all the risk, right? But you can also say when this risk does happen, this is how we're going to manage it.
Yeah.
There
That
you
we
go.
have everything, we know how to do it.
Yeah.
And then you love lips. Why do you like injecting lips so much? What
Because
is it about lips?
you know what? People think that injecting lips is so easy. When you go to your introductory course, they put lips in there, right?
Yeah.
But people don't know lips is probably one of the hardest areas to inject, right? Not to inject physically, but to get it right,
Mm-hmm.
right? Because the thing is that all lips are different, right? Very different. They move differently. The
Mm-hmm.
muscle attachments is so different, right? Like the layers, the texture, the tissue that's inside there, right? People's habits, So that's why there's no such thing as a technique, right? I
Mm-hmm.
believe there's more of like an approach,
Yeah.
right? How you would approach every single lip, right? Like what are the steps that you do in order to make sure that you come to a good conclusion of how you're going to treat it, right?
Mm-hmm.
So that's why I feel like, to me, I love lips not only because it's complex. If you do a good job, oh my God, they look amazing.
Yeah.
They look so freaking good,
Yep.
and it's one of the areas that, like almost like the most common area to treat,
Mm-hmm.
right? If you are able to master like lips, then I feel like like you'll be great in the
You'll be
industry.
set. You're
Yeah.
right.
Yeah, it's almost kind of like I feel like lips is kind of like the poster child
Mm-hmm.
of injectables,
Right.
right? When people think Botox and fillers, they think lips,
They do.
right? Even people who don't know the difference between Botox and filler, they think lips is what you got
Yeah,
done,
they're like, just
you
don't
know?
do what everybody else does. Even though right now everyone's doing natural injections. But
Yeah, yeah. I mean, natural, it really depends. Because I was actually talking to like one of my colleagues where I work at, like right now in the hospital.
yeah.
She did also mention that people are actually asking for more like natural, but I don't know, it really, it's very kind of like vague of like what natural really means to everybody.
Mm-hmm.
For me, like based on like my clients, is that when they say natural, I think natural in the sense that like people are not gonna point out their lips because it looks crazy,
Mm-hmm.
right? Because I don't think there's anything natural about like 1 ml in one session. You know
Yeah.
what I'm saying? Right? So that's why I was like, now I understand, because it's
Yeah.
almost like everyone would say natural, but depending on the person, it could mean something different.
Yes.
Yeah.
So I always ask, for example, for Botox,
Mhm.
like, do you want natural or do you want frozen? They always say, I want natural, but I don't want to move my face.
Exactly. That thing, that
So I'm
thing,
like,
that thing,
okay,
right?
so you're going to be frozen.
Yeah. So now that's when you're going to cook and give
Yeah.
them a dose where, you know what? Let me make them, like get them their natural, but not frozen. So you're going to think that it doesn't move, but they don't feel like it's not moving, right?
Yeah.
Right. So
It's so confusing.
right? So there's actually a lot of mental work that goes into this, right? People just
Yeah.
think that like, oh my gosh, you got like soft girl nursing job and all of that. All you do is just inject and make
La
people
la la
pretty.
la la.
Exactly. Nope. No, 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 no. There's a lot of mental work goes in here, and it
Yeah.
doesn't stop after you inject. It goes on until you, right? Yeah, 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 right.
And we get the emails and we get the
The text, the
texts,
follow-ups, the
the
everything, right?
DMs.
Exactly. And,
What
and
do you think of this?
exactly, right? Because the thing is too, it's like, like like you're actually like more worried. You're more kind of like anxious, than the client themselves, right?
Yes.
Because it's like you're thinking like, oh, how is so and so doing? How is my treatment doing on them? Like, how do they feel? Oh, they haven't said anything yet, right?
Do they like it?
Do they like it? Do they not like it? Should I message them? Should I not? You know what I'm saying?
Yeah.
So you see,
It's been 3 months. I haven't seen them.
exactly, right? Like what
Yeah.
happened, right?
Yeah.
So it's those things, right?
I know, but
So
we love it. We live for this. We
exactly.
live for this hustle and this
Yeah, yeah,
grind.
yeah.
It's so addicting.
It does.
I
It
can't
does.
imagine it like
Yeah.
not being like this.
Yeah. If it
Right?
was just too like easy, then it's just like there's no thrill, right? The thrill is like really like how hard you have to work,
Yeah.
in able to kind of like survive,
Yeah.
like in this industry.
Like we see these like complex lips and we're like, "Oh my God, how are we going to do this?"
Oh yeah,
And
yeah.
then we do them and it's like, "Oh my God."
Yeah, yeah, like you're really there. You're nervous because the thing is like you have to do it right the
Yeah.
first time, right? Because having to kind of like botch that and having to have them dissolve it and then do it again, not only is that dissolving doing something to their natural anatomy, right? But it's like how are you going to kind of get that same texture, right? How are you going to get that like
Yeah.
same kind of like that same kind of like consistency, right? As you did the first time, right? So it's really those things,
And
right?
finding the right product.
I have a team, my left hand and my right hand. This is the team.
I'm like, what's he gonna say?
All
What's
right,
gonna
this is the team, guys. This, and maybe
Yeah.
this too. You know what I'm saying? But
Wait, this is your feet or this is in your butt?
huh? That too. That too. That is like the money maker. Oh my god! You know what? One of like our most shared videos. I think we almost probably had about like 800 shares. But when I did this TikTok to this like Nicki Minaj song, oh my gosh, yeah, that's what I was kind of like, ooh, okay, maybe like that should be like my next kind of like like selling point. You know what I'm saying? Get all the views. You know what I'm saying? Let's get them views.
Let's do it.
All right. So that's what I was there. But like no, but yeah, so especially like starting from scratch, doing it all on your own, right? Also, if you have, let's say, kind of like another job that you're working,
Yeah.
right? Trying to kind of like balance all of that, right? You also have your family, you also have like, like your lifestyle. For me, like I go to the gym every morning before I go to work, right? So adding this into the mix, there's gonna be a lot on your plate,
Yes,
right? But like if your goal is to eat, you can't complain. There's a lot on your plate,
exactly.
right?
Yep. I love
Right.
having my plates are full. I have three big
Mm-hmm.
ones, and
Yeah.
I love them full.
Exactly, right? It's
Fill
like
them up
exactly like
all the way.
it doesn't kind of like scare you. It doesn't kind of intimidate you,
Yeah.
right? Because you're doing this for a reason. You know the
Yeah.
purpose why you're
There's a
doing this
goal.
for, right?
Yeah.
And then as you go by, it's like you start to fall in love with the hustle. It's almost sometimes when you feel like, you know what, I don't want this struggle to end because this what is what drives me to kind of like push myself, to the,
Yeah.
to like I want to see I want to test my limits. I want to see how far I would be able to go. Like you're busy, you're answering DMs, you're making content, like you're doing inventory, you're doing, like you're accounting for your stuff, right? You're answering, what do you call it? When your friends send you reels and
Yeah.
stuff, you
No,
make sure you
that's
don't
just,
forget that. You know what I'm saying? Because people
yeah.
feel some type of way if you get too busy. Entrepreneur life is
It's different.
no joke.
Yeah.
It is no joke, right? And that's unless you're actually kind of like, what do you call that? What Kim Kardashian say? You know what I'm saying?
Yeah. Yeah. Get your ass up and work. You
That
gotta
one
get
too.
your ass up and work.
It's like, or maybe if you have like,
Nothing to
something that you're
do.
passionate about, blah 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 blah. Remember that. I mean, that's actually really freaking true. You
Yeah.
know?
Yeah. Worry about yourself. Stop worrying about other people. Follow all my pages, please.
Exactly.
Yeah.
Yeah.
All of
Yeah.
our pages. And don't just watch.
Right.
You're
Exactly.
freaking just watching.
Yeah.
Like,
Don't
calm
watch
down.
and don't watch.
Don't
Book.
watch.
Okay. Don't watch book. I'm trying. It's like like I'm trying to get like my body done. You know what I'm saying? Come on, guys, book, please.
We're flying out. We're
Oh my
flying
god,
out
we're
to
trying to
Turkey.
fly out. You know what I'm saying? But like, no, honestly, for me, I feel like once for me, like what my goal is once I get it big, like I really want to go to the UK because honestly, like if you've seen the injectors in UK,
We have seen.
oh my god,
I've
yeah,
seen.
yeah, yeah.
It's
Oh my
insane.
god, they're crazy. It's like I don't know, like maybe because I think like over there, like people um it's almost kind of like in here, it's like it's very regulated here, right? You
Mm-hmm.
have to be like a certain like medical professional to
Mm-hmm.
be able to do these treatments, right?
Yes.
Like you can't just be like opening up a basement, like your homegirl has like like some silicone in here, like no, in here in Canada that's not legal.
Yeah.
You have to be like a nurse, an MD, like NP. I think in other provinces you can be like a pharmacist.
Mm,
Even like even here, yeah, pharmacist I think in
oh,
BC. Don't quote me
damn.
on this, but I think they
Okay.
can.
Maybe.
Um,
Okay.
in here too, like even dentists,
Yeah.
like because they treat everything like around like the perioral area, so they
Mm-hmm.
can even do like lips if they want to, right in
Yeah.
here, right? So so that's why it's it's one of those things where it doesn't really matter, right? Like like you still have to be a professional, but like it doesn't really matter what designation you are within those, right?
Mm-hmm.
Because what really sets you apart is that how well you do your work,
Yes.
right? Yeah, but I think like in the like in the UK and like in Europe, right? It's
Mm-hmm.
like you can be anybody.
Yes. Yeah,
Yeah.
in UK you can be anyone and inject like an esthetician.
Mm-hmm.
France you have to be a
Mm-hmm.
doctor. A lot of places it's doctor in
Mm-hmm.
Europe, but UK in particular.
You can even be a waxer. You know what I'm
Yeah, you
saying,
can
right?
just be anyone.
Right, exactly, right. Well, it's like you want to do your lips, which lip, right?
Which
Exactly,
literally
which lip,
insane.
right? So
Insanity.
that's why, yeah. So, but I feel like over there because like it's more heavily saturated over there.
Yes.
That's why I feel like they're able to come up with different ways to like treat, right? So that's why, um, I feel like they're a little bit more advanced, I guess,
Mm-hmm.
than how we are in here. I don't know. That's just my opinion, but
Yeah.
my
The other
fa-
side of the world.
exactly, yeah. So that's why for me, it's like most of my favorite injectors are from the UK.
Interesting.
Yeah, yeah,
Because they're doing things, they're being very risky.
yeah.
Yeah. A lot of injectors here that are doing very well, they do go to trainings in the
Mhm,
UK. You're
mhm,
right, now that I
mhm,
remember.
mhm.
And they've learned some crazy things.
I know, I know. Like that's what I was kind of like in here. I was like, I wouldn't even believe it. Like, oh my God, like I never really kind of like would look at it like in that sense of how to do it
Mm-hmm.
like that way because, you know, for us in here, it's like when you know, we have like a principle that we follow, right? Like
Yeah.
there's always kind of like areas like, oh, in here you can only treat it this way. In this area, you can only treat it that way. It's like
Mm-hmm.
for us, it's like, you know, if you go beyond, you know, like those principles, you're gonna risk somebody,
Yeah.
right? But in the UK, you know, when I see like how they do their stuff, I'm kind of like, oh my gosh, in here people will be losing their minds trying to kind of like do it that way, right?
Yeah.
So
We're very proper,
yeah,
cookie cutter.
yeah. We're a little bit more like you
We're
know, like
uptight. We're
yeah,
uptight. We're
yeah.
anal.
Exactly. We love to have our floaties on when we
Yeah.
dive into the pool.
But not us.
Yeah.
Not us. Not today.
Oh no, 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 no,
We're
no,
taking our
not
floaties off for
today.
our
Floaties
TikToks today.
off today.
Where do you see the industry going in the next 5 to 10 years?
I hopefully like it doesn't go anywhere, right? I hope that more people will be more open to, you know, like these treatments. Um, you know, because I remember back then people would be a little bit more like hush hush about this,
Mm-hmm.
right? There's still people kind of like, oh, I don't want anybody to know, or I want to be like very, very subtle, right? But you know, I feel that when you go get these treatments, right, and when you go through like the pain, because you still do feel a little bit of pain. Yeah,
Yeah.
there's numbing, but you know, there's still a good amount of pain in there, right?
Mm-hmm.
It's like you don't want to be looking like you haven't got anything done because to go through all that pain, I'm like, You
Yeah,
know what I'm saying?
no.
For me, like, I want to look different. I want to look changed. I want to be a different person after this,
Yeah.
you know? And it costs like literally like an arm and a leg. You are paying for this, you know, it's almost like a Gucci bag. You know what I'm saying? It's like you want to wear this Gucci bag with pride,
Yeah.
you know?
Beautiful skin.
Yeah, beautiful skin, like nice, you know, like nice contoured features, you
Yep.
know. So it's like, you know, I want people to kind of like be, you know, like be proud of their treatments, right?
Yeah.
Like not hide it,
And
right?
tag.
Yeah.
Tag your injector.
Yeah, tag your injector, shout us out, you know what I'm saying, you
Yeah.
know? But I mean, honestly, like for me, even if they just like refer, you know, like word of mouth, whatever,
Yeah.
it's fine, you know?
It's okay.
Yeah, yeah.
So we'll keep, do you think in 5 to 10 years it's going to be natural? It's going to be, or are we going to go back to that like
Natural. You know,
that
I think
baba
trends are
boom?
like it's kind of like changing,
Mm-hmm.
you know, like because at one point it's like people want like a little bit more like out there, right? They
Mm-hmm.
want to be kind of like very like super snatch, like very, very kind of like contoured, you know, everything like popping. And then you go to kind of like a little bit of like a clean aesthetic.
Yeah.
And then I think like now people are kind of like, okay, like everybody just looks the same. Let me kind of like be a little bit different. It's I think that's what
Mm-hmm.
happens, right? Like people kind it becomes too like one trend becomes too saturated. People want to do something different,
Yeah.
but it's like you can only recreate like something, you know, like you can only recreate something like so much that it starts kind of like, you know, like looking like what it was, you know, like before, you know,
Mm-hmm.
what was trendy. So I think that, you know, I think, you know, like beauty industry will still be here, but I feel like it's definitely going to have maybe like some more other things, you know, along the way, because as more products are getting introduced, more concerns are popping up. So I think it's definitely going to be there, definitely bigger for sure.
Yeah.
Yeah,
I'm so excited.
me too.
There's so many things coming. And we're going to get more approvals for things, more
Hmm.
peptides.
Yeah, peptides are like on the rise too,
Yeah.
right? Yeah.
I don't know much about peptides.
Yeah, that I think that's more kind of like very I think more kind of like more health. Like we aesthetic here, you know what I'm saying?
Yeah,
You know,
yeah,
we like to keep aesthetic here, guys. Yeah.
yeah. And then we'll do the NAD plus, whatever. Fine, I'll do it.
Yeah. I don't even know what that is, honestly.
Energy, I think.
Oh, energy. You know what will
Question
get
mark.
right? I think what will give you good energy if you have good lips.
Yes, yes.
A good lip
A
is
good
all
lip.
the energy that you need.
A good lip, a good chin.
Yeah.
Like lips, cheeks, chin combo.
Is that your combo?
Yeah, that's a combo. That's a good one.
That's a good one. For me, it's like I feel like for me, my if I were to choose kind of like a perfect trifecta, I think it will be chin, lips, and nose.
Oh yeah, because I don't do nose. That's why. No, nose is very important
Mm-hmm,
because you
mm-hmm.
want it all to be projected properly.
Very aligned, and also it's like I feel like those three areas are the areas that you can actually see from the front, three quarters, and from the side, right?
Kev knows what he's talking
I
about.
know my shiz, you
He knows
guys.
it.
What I'm saying, I'm not all about TikToks. You know what I'm saying? I'm not just all
Yeah.
about kind of like random stories.
Yeah.
Because I think like you know like um, it's nice to be entertaining,
Yeah.
but also making sure that you know your stuff,
Yes.
right? There's a fine line between like, like being kind of like a TikToker and like a professional,
It's
right?
very difficult to draw the
Yeah,
line.
yeah, right. Because in this industry, you have to have both, right? Because it's like in here, your personality will also like, like bring in clients for you,
Mm-hmm.
right? It's like, you can be good at what you're doing, but at the same time, if clients come in and they don't really feel your vibe, you don't really have a good energy, it doesn't matter how great the treatment that you did for them, they're gonna be like very discouraged coming back because of like your attitude,
Mm-hmm.
right? So I feel like, that's if I would be able to give like, let's say like, like a new injector,
Mm-hmm.
right? Make sure like you bring in good energy,
Mm-hmm.
right? Because, for example, when you're new, you don't have like any experience, right? Your personality, right? Like how, like your energy, like, like how you are when you interact with them, like how you communicate with them, right? That's also like a selling point there,
Yeah.
right? Because, you know, like, because the thing is like people will remember you, will be like, oh, like when I went there, like I felt like heard, like he was easy to talk to, like didn't really kind of give me like any bad vibes,
Mm-hmm.
right? Like I will, like I feel comfortable here, I will go here, right?
Mm-hmm.
Even if you're new, I felt comfortable with you, I will go with you,
Yeah.
right?
Yeah. I agree.
Yeah.
All
So
right.
that's definitely like something like I will, recommend for
For a young and new injector.
injectors. Yeah.
Yeah. Even for a young entrepreneur, like
Mm-hmm.
just be good
Mm-hmm.
inside.
Yeah, be personable, right? Have good like people skills, right?
And then your outsides will be better also.
Yeah, yeah.
Because there's people that they haven't, people hate when I say this word. They're ugly, okay? Ugly. People hate that word. But there's people that are ugly on the inside, and that's what transfers to their ugly on the outside. They're not actually that ugly on the outside, but
Mm-hmm.
because of their insides.
Yeah, the energy, right, from the inside, it will radiate, right? It
Yeah.
will show, right? Like just kind of like the moment that you pop out a smile, even if you have like a really bad hair day, you're not having a good face day,
Yeah.
right? But the moment that you pop a smile, right, it changes.
Yeah.
People don't care about that,
Exactly.
right? So that's why it's like it's good to have like a really positive attitude, right?
Exactly.
Like
Yeah.
don't get intimidated, your skills are not up there, but just be honest, be transparent, right? And yeah,
That's it.
that's it.
Do you have anything that you'd like to share to injectors or your clients? Anything before we wrap it up?
Anything that I would like to share for my clients, oh my goodness, it's like I just want to say like a big thank you for my committed baddies. Um, I built all of this for you guys. With you guys are in the back of my head, just kind of going through this, making like the decision to come back. And to the ones who have been like waiting, didn't get like the opportunity to kind of get a treatment from me, this is your time. We're finally back. And to the new injectors out there, like like don't be scared. Don't be intimidated. If you are really passionate about this industry, that will fuel you to just keep going, right? Like, don't get intimidated when you see like, like other people, when they seem like they're doing like, really well, they're already popping, because, they also had their day one, right?
Yeah.
All of us had our day one, right? You will have yours too, right? It's like it's like a rite of passage, you know what I'm saying? It's like
You have to go
you
through it.
you have to go through it, right? Like it builds your character, right? It builds you up as an entrepreneur, as an injector, right? So like it will be busy, it will be chaotic. Sometimes it will be dry,
Yeah.
right? You will make no money in the beginning, right? But like I said, if you are really passionate about the industry as you say you are, right? That's all that you need,
Yeah.
right? Yeah.
It's beautiful. All right. Thank you so much for making time. Yes,
Thank
Nurse
you
Kev
so
is back.
much.
And that's it. Yeah, yeah, the crown's on. And we'll see you again. This is just part one. We'll do a part two, and we're gonna go film TikToks. Let's go. Bye.